Hi friends, my name is Preeti. So we'll go into the next CNS disorder, that is Parkinson's. Okay, we'll study about the anti-Parkinson drugs. So what is Parkinson? Then how it is caused? Okay, these are some of the neurodegenerative diseases and the neurotransmitter responsible for that disease, and also proteins and deposits. Okay, in pathophysiology, for all these neurodegenerative disorders, this single peak is enough. Okay, for pathophysiology. See, in Parkinson's, what happens is there is a decrease in dopamine levels. It is due to the damage of nigrostriatal pathway, which is a major pathway in the production of dopamine. Okay, so due to the damage of that pathway, it arises a condition called Parkinson's. That damage is due to the formation of proteins like alpha-synuclein and parkin in the neuron. Okay, uh, it may be due to the genetics or it may be due to the injury. Okay, this formation of these kind of proteins and deposits because of family history and also due to some injuries, it may lead to these kind of deposits. Okay, and there is a deposition of Lewy bodies, and there are some accumulation of some proteins like alpha-synuclein and parkin. Okay, just remember these in pathophysiology of Parkinson's disease. Okay, these points are enough. And next we go to the drugs which are used to treat this Parkinson's disease. So mainly our target should be, as there is a decrease in dopamine levels, we have to increase the dopamine levels. And also this Parkinson's disease is characterized by tremors, nothing but involuntary movements, and rigidity, stiffness of the muscles, and dystonia, nothing but muscle spasms. So to reduce these symptoms, these Parkinson's symptoms, we use anticholinergic drugs. Okay, so our two targets are one on the dopamine, we have to increase the dopamine levels, and one on the symptoms, we have to decrease the Parkinson's symptoms. So first we will see the dopamine. So here you can say replenishing brain dopaminergic system, dopaminergic drugs, and also we have to inhibit brain cholinergic system, because if you see acetylcholine, cholinergic means acetylcholine. Okay, acetylcholine, it acts on muscarinic receptors. On muscarinic, M1 receptors are present on CNS. So when acetylcholine acts on that, there is a CNS excitation. Okay. So what we are doing here, in Parkinson's condition, there will be imbalance between this acetylcholine and this dopamine neurotransmitters. Okay, so what we are doing, we are inhibiting that acetylcholine action on that receptor. That's why we are using anticholinergic drugs also. First, dopaminergic drugs, dopamine precursor, levodopa, and peripheral decarboxylase inhibitors, carbidopa and benzarazide, which is a hydrazide derivative, and dopamine releasing agents or facilitators, amantadine, which is an antiviral drug. See, many times they have asked antiviral drug used in Parkinson's disease, nothing but amantadine, and dopamine agonist, bromocriptine, pergolide, lisuride, and carpercoline. Okay, these are all drugs. They are indole alkaloids. Okay, and then non-ergot are apomorphine, ropinirole, pramipirole, and pyripidine. Okay, this ropinirole, they act on D2 or D3 receptor, and pramipexole, they act on D3 receptor, and bromocriptine act on D2 receptor. Okay, and it is also D1 partial agonist. No, D1 partial antagonist. Okay, and dopamine protective agents. Nothing but the drugs which inhibit the dopamine metabolism. They are MAOB inhibitors, selagiline and rasagiline, and CYMT inhibitors, and entacapone and tolcapone. This tolcapone is better in penetrating the blood-brain barrier. Okay, and next, anticholinergic drugs like central anticholinergics like trihexyphenidyl, procyclidine, piperidine, and benztropine. And next, antihistaminics like orphanadrine and promethazine. Okay. Next, we'll go to the action of the drugs, how they act. So this is a blood-brain barrier. See, in a classification, nowhere we are taking the dopamine directly because dopamine is a lipophilic drug. Dopamine is a hydrophilic drug, whereas this blood-brain barrier is highly lipophilic. So this hydrophilic drug, it cannot pass through this lipophilic membrane. Only lipophilic drugs can pass through this blood-brain barrier. So what we are taking, its prodrug, which is levodopa. It is a lipophilic, so it can easily pass through this membrane, and after passing the membrane, there it gets converted into the dopamine. See, here you can see dopamine. But what happens? Levodopa, it may get metabolized. See, it may get metabolized by COMT and dopamine decarboxylase. So what we are doing, we have to take again COMT inhibitors, entacapone and tolcapone, and dopamine decarboxylase inhibitors like carbidopa. Then what happens? This levodopa enters, crosses the blood-brain barrier and enters the central nervous system, and there it gets converted into the dopamine. And here also the dopamine, it may again metabolized by MAO, monoamine oxidase enzyme. So again we have to take MAO inhibitors, which inhibits the degradation of dopamine. The examples are rasagiline and seragiline. Okay, and the dopamine agonist are bromocriptine. Okay, so this is how the drug actually works. Okay. That's it. This is enough regarding the Parkinson's. The pathophysiology, what are the proteins getting deposited, and also the classification of the drugs. Okay. Thank you. We'll meet in our next video.